Hey everyone, so in this video we're going to cover the muscles that we've learned so far up until the start of section 3 to where we start learning about arteries and veins. Um, so let's dive right in. I have the skeleton set to where we can actually see like origins and insertions, so hopefully that helps. So first things first, here's our levator scapulae connecting into that superior angle of the scapula. We'll just get rid of them as we go, that way we can keep them straight. Knowing what we know now, this is our brachial plexus. These are the nerves coming down into that arm. Okay, it helps. Well, not helps, but allows you to be able to move these muscles. Okay. Uh, Looking above the spine of the scapula, right here, here is supraspinatus. Uh, this is part of your rotator cuff muscles. So, kind of like we saw in the book, you can see it starts in that supraspinous fossa, continues to go lateral, goes underneath that acromion and that clavicle, and then it connects into your humerus. I forgot to start with the deltoid, so I will come back to that one here in a second. Um, but here's your deltoid. Connects into the spine, that scapula, all the way around that acromion, and then down the clavicle. And then it's connecting down here into that deltoid tuberosity. And that nerve um, that kind of innervates all those muscles in your brachium or the proximal part of your arm, that's going to be your musculocutaneous nerve. You can kind of see it right there, musculocutaneous nerve. So let's get rid of this deltoid. Let's come back to that supraspinatus really quick. So again, it's diving right underneath that acromion, comes out, and it's connecting into the greater tubercle of the humerus. If we're looking more medial, this is going to be that long head of the biceps right there, coming up that intertubercular groove that we've talked about. Let's rotate that so you can see. So coming up the intertubercular groove, connecting into the supraglenoid um, tubercle. So let's get rid of the supraspinatus really quick. Now you can kind of see that hole that it fits in right there. Continuing with the scapula, here's our infraspinatus. And just like we've said time and time again, supraspinatus connects in right here, infraspinatus, posterior and inferior right there. And then you can see that hole that it filled right there in your scapula. And then it's teres minor right there, connecting in right there still at the greater tubercle. All right. Now it kind of looks like basket weaving in here with teres major and with the triceps. So we've got teres major right here, and it's coming through, kind of like where your armpit is. It's coming through, and it's connecting in that intertubercular groove, part of it at least, right? But you can't see. We'll leave that one there, just so that you can see where it attaches. Here's your pec major, right? Huge muscle coming up the sternum and along your clavicle and connecting into that intertubercular groove in there. So let's get rid of this. All right. Um, Here is your subclavius right here. From the clavicle to rib number 1 right there. We'll go ahead and get rid of that one. This is your pec minor, going from your coracoid process to ribs 3, 4, and 5. All right. So, looking at this right here, here's your short head of the biceps. It comes into a single tendon down here, but the short head is going to be on the medial side, and it's coming all the way up into that coracoid process. If we get rid of that short head, we then see the coracobrachialis right there. Let's bring that muscle back. Also because I want you to see the long head. So, kind of looking at the humerus right there, it's got that gap between the lesser tubercle and the greater tubercle coming up, and then connecting right there into the scapula. Again, there's coracobrachialis, and that's going to be going from that coracoid process of the scapula down into the humerus. We've got musculocutaneous that innervates it, running down right there. And it's like that nerve is sandwiched between all of these bicep muscles, basically. Um, but now we can come back and look at this teres major right here. There you see it right there, coming in and wrapping around, and it's connecting basically in that intertubercular groove. Um, we'll get rid of this. And then it's kind of hard to see, but here's that anterior side of the scapula right there, and that's going to be subscapularis. So wraps around, comes underneath coracobrachialis, connecting into that lesser tubercle. We talked about coracobrachialis. Let's get rid of it. Let's come around to this posterior side. I hope I'm not making you dizzy as I keep spinning around. Um, but here we go. Here's the triceps, and there's three heads, right? We've got this medial head that sits right there, um, down closer to where the um, elbow joint is. We've got our lateral head that connects in to um, that central tendon for it, and it's connecting right into your olecranon. Okay, if we fade it and look more, it's kind of hard to see still. Um, I'll show you just on the plain skeleton all the insertion points, and then we have our lateral or our long head, excuse me, of the triceps connecting into that infraglenoid tubercle of the scapula. So here's that infraglenoid tubercle right there. And for some weird reason, uh, this model doesn't have the uh, attachment sites are on the triceps for the lateral head and for that medial head. I did a video on these muscles, and it will show you the insertion sites for them. So if you want to see those, they're in there. Let's get this one while we're back here. Here's our inconius muscle, and it's connecting into that ulna, and then coming over here onto that lateral epicondyle. All right. Here's our brachialis muscle. It's connecting into like that bottom 2/3 of the humerus, and then it's coming down and connecting into that ulnar tuberosity right there. And then here's our brachioradialis. This muscle is very important. It helps you to distinguish between flexors of the antebrachium and the extensors of the antebrachium. You're going to be hearing a lot about this muscle for the next like week or two um, by the time you get to this video. So there's that. And I think we covered all those muscles I had for you. Hopefully that helps you at least this far into the course. And we'll see you in the next video.
All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.